All right. So, week 8, how did that happen? I'm sure you probably feel that's been a bit of a long haul maybe, or maybe it's gone fast for you. Who knows? But we're week 8, so we're checking back in with our workshop this week. So we're going to have a little bit of a placement debrief. Now, I know, Alana, that you've effectively not on placement at the moment, but you have done your placement. So it's still, I think this is still relevant to you. You can just talk about what you experienced within your group while you're away. And we're also going to talk about the different, we've got a small group, so we'll just do it as one, I think, today. We'll talk about the different organisations you're in, how you're finding it, and I'm keen to get your feedback as well, and we'll just have a bit of a discussion around that to start off with. Then a little bit of academic content today around data reliability and validity. Some of you are doing different data collection and some are not, but I think this is still, something that you can learn about how we critically look at what we're collecting, and if we're collecting is what we actually want to be collecting. And then I was hoping to get an Indigenous presenter today to talk about cultural competencies in Indigenous health. She was unavailable, and I didn't feel it was right just to have anyone else do it. So I'm just going to give you a little bit of a window into that, just to put it on the forefront of your mind in terms of the fact that we need to start considering this, but I definitely don't want to step into her shoes in any way. So it's just a little snippet on to start thinking about how we look at Indigenous health from a cultural perspective in public health. All right, so our learning outcomes this week is looking at the ability to identify placement, organisational structure, core values, and what health focus is happening within that organisation. And really, these are just talking points for us to start to look at all the different avenues that you might be able to head into with a public health degree, and how they all differ slightly. And then, like I said, we're going to critically look at that data collection from a reliability, validity point of view, and also look at that important aspect of cultural safety. All right, I'm just going to turn off the recording now, because I feel that I want to open up this placement discussion as a safe space that you can voice your concerns or whatnot, so that's not held on the record and that you feel comfortable to do that. I'm going to turn this off and we'll resume that when we come to the data validity reliability discussion. So like I said, depending on where your project is, you may or may not be playing into this data collection space, but I thought it was also a good chance for you to start thinking about, in terms of data, the rigorous nature of your data that is used, but it also gives you a little bit of content knowledge to look at when you're looking and synthesizing literature that you're going to be looking at for projects now or in your future. And often when your graduate positions in public health do look at your ability to critique data and review evidence to build policy and practice. So I thought I'd just touch on reliability and validity within data. So to get us sort of thinking in this space, is anyone designing a study tool at the moment?
What do you mean, sorry, by study tool?
Study tool, so it could be looking at a questionnaire. It could be looking, well, that's a good question, Jess, and actually it sort of fits into my next question, which is what types of some of the assessment tools that can be used to collect data. So we'll come back to your question. I'll just see. So Alex, are you developing something?
Yeah.
Yeah, what are you developing?
For the collect data.
Yeah, to collect data. Are you using something to collect data?
Usually from the government website.
Okay, yep.
And also the PubMed.
Ah, yes, yep. Okay, so that's where you start to design your study tool. Okay, excellent. Aileen, are you going to need to sort of look at data at all relating to your projects?
I think so, yeah. But yeah, I don't know from where I will get that yet. Yeah, like I said, I'm just like barely starting,
Yep.
so I'm not sure, yeah.
That might be a good question for you to think about when you meet next with your supervisor is how you can access some of the data from the case study that you're reading, because then you can use that to build into your report. They might be able to give it to you, like he might be able to give you the actual data that they have already that you can use. Yeah. All right, so when we're talking, it's a good question, Jess, in terms of what are we talking about in study tools, and that term and question is really broad, and often it's used when you're either starting a project or evaluating a project. So it can really bookend projects. And when you're designing or starting a project, you could be looking at designing a questionnaire that looks at the need of a service delivery in your case. So you could be surveying health workers, like questions for health workers. You could be surveying parents. A study tool for yours could also be looking at all the different wait times. So it's looking, if you're looking at developing a project in a space, the study tool could either be questionnaires, it could be interviews, or it could be at the other end too, where you've had a service in place or an intervention in place and you want to know how well it's done. And again, you're looking at quantitative data, qualitative data, and the different ways of collecting it. Is there anyone that can, I gave a few examples, can anyone sort of think about what some of the data collection tools may be?
Surveys?
Yes. Yep. Excellent. And how can you deliver surveys? What are some of the different survey types?
So they could be like face-to-face, maybe in a mail, like online.
Yep.
Yeah, this sort of.
Yep, absolutely. Anyone else got any thoughts on what are some of the different ways you can collect data?
You could do through like ethnographies as well as observations.
Yep, absolutely, absolutely. That's sitting more at that qualitative end, which is great. And the other thing too, when we think about data, is that you think about survey, and that's more that quantitative data, but then it's also how we look at what we're collecting in the survey. So you might have like a Likert scale type data collection, you know, a 1 to 5 good bad data collection, or you might just have a tick the box dichotomous sort of yes no answer question. And looking at what is best is something that it's important to do when we're designing these tools, and what we're really wanting to ask is what is the information that we're wanting to achieve, and is that the best way to achieve it? So is all data the same? Do you think all data is the same?
Qualitative and quantitative.
Yeah.
Yep, go on. Was that you, Aileen, or Alana?
Yeah, I was gonna say the same thing, like qualitative or quantitative. That's one. Maybe like some data can be more specific, like if it's an open question or closed question data. So yeah, it depends on what the researcher is trying to achieve. So
Yep.
it's not going to be all the same.
Yep, excellent. And no, and the thing too, and you're absolutely right, it's the type of data and how in-depth it is, but then it's also important to look at, are the questions we're asking actually what we want to know? And sometimes we might think that we're collecting information on what we want to know, but it's actually not the outcome we intended. And then the question is, well, is that data reliable for us to use? And that's where it gets a little bit more technical, and this is where what we're talking about today really what I want to do is push you into that next level of critical thinking, that you're used to looking at the different types of data, but then we have to critically look at, well, even within that type of data, is it reliable and is it valid, and is it a validated measure? So that's what we're going to have a little bit more of a talk about today. So when we're talking about reliability and validity, it's important to think about, is the measure something that's actually measuring what we want it to do, and is it measuring the intended outcome? So an example of this is, say, if we're looking for distress within patients or anxiety within patients, is the questions that we're asking actually going to answer that, or is it going to just give us, you know, basic data on you know, if they're, you know, just approaching things differently, or if they're so if you're actually looking for depression, is it actually going to be a true measure of depression, or is it just going to show that someone's mildly unhappy or, you know, not satisfied with something in their life? So looking at those different depths of data collection and outcomes is what we're talking about when we're talking about the reliability and validity of something. And it's also a series of checks, as academic or evidence-based practice really looks at, in terms of, you know, if you're trying to measure something and it's not measuring that, and then you report that it is measuring that, well, then that's obviously not a very rigorous way of conducting research in an academic sense. So reliability really is looking at the degree to which the tool actually is stable and consistent across what you're measuring. So it can be across time, it can be across what it's measuring, and also across the different researchers. So this is when we start talking about, you know, if there's bias within the data, and if it's actually looking at the differences, and are the differences accountable. So sometimes you might have someone do the same test 3 different times and they get different results each time. Then you really need to start thinking about, well, why is that different? You know, theoretically, if you've got the same test looking at the same item across time, then it should produce the same results theoretically. So then we need to look at why the differences might be occurring. Was there someone different administrating it? Was it a different time of day that it was administered? So we need to start thinking about what the data is actually showing us. And it's easy to make assumptions, and this is when this idea of causation, you know, we can say that this causes that, but if the test isn't actually consistent, we can't really say that there is a causation there. So reliability really looks at the consistency and the repeatability of the findings, and if yielding the same results to show that the data is reliable. And that's something to really think about when you're critiquing work or when you're trying to develop your own study tools as well. So there's several ways we can do this, and looking at different types of reliability within data. And the first one is looking at the test-retest reliability. And this is what I was talking about in terms of how it's administered over time and what the result is over time. Okay, so theoretically, if it's got a strong reliability, it should have the same result when it's tested and retested over time. So an example of this would be when a test is designed by students learning psychology, and it's assessed and it's given to the students twice. It's given to them once, maybe at the start of the week, and then it might be administered the following week. What happens is that the researchers then combine the results and look to see if they're the same or if there's differences. And there's a whole lot of statistical testing that we won't go into that you can do to test that. But basically, if there's a big change in results, that gives us an idea that we need to, and it's the exact same study, the exact same time of day, you need to start looking at why. But if it's repeatedly the same, then we can say that that test has reliability. So that's the retest. Another one is looking at the actual internal consistency within the study. Okay, so, and this is looking at what the actual internal differences or confounders might be within those individuals. So we talk about the confounders, but it's looking at if you've got different versions of a tool, so it might be a slightly different psychological test or different dietary test. But what we want to know is if it's administered to the same group of individuals, it should have similar results. So this is sort of flipping it around from what the first one was. The first one was the same test administered at different times and looking at the differences. This one is a different test administered to the same group, but it should also show the same, because then we know that the same group has the same knowledge, has the same skill level, and has the same, from the same demographic background and all those sorts of different confounders that can be different across groups. So if there's big differences in those tests, then we need to nut down a little bit more and look at what it was asking and why there was differences as well. So example is if you're looking at the reliability of critical thinking assessment, you might have a large set of items, and then you split the questions into 2 sets, and then you get the same group to do both sets of questions, and then look at if there was a similar response or not. Okay, I'll ask questions after I've gone through this third one if it's all seeming a bit much context wise. So the third one is looking at inter-rater reliability. So this is looking at that difference across the researcher applying the test. Okay, so it's looking at that variable in the fact that we're all human, and we all slightly talk differently. We all observe things differently. If you're doing ethnographic or qualitative research, you might be asking things in a slightly different way. So to ensure that there is consistency in terms of what the questions are wanting to measure, we look at how they're being measured by different researchers and then compare them. So you will get to measure this. What you do is you have different researchers ask the same group of students the same questions, and if there's great variation in this, then we can look at the fact that there's also going to be different inter-rater reliability or greater inter-rater reliability, and we need to look at how we can bring that in. So you might have 2 or more observers watch the same video or the same student, and then what we do is talk about how that their interpretation might be different and how we can find a middle ground for that. All right, before I move on to validity, does anyone have any questions? All making sense? Yep. All right, so then we're talking about, so that's reliability. Now we're wanting to look at validity. Okay, so the validity is really looking at more that, so the reliability looks at how reliable the measurement is, and the validity looks at how the actual content represents what variables are being measured. So if we're looking at, if you're measuring things and we're wanting to look at psychological outcomes, then is it actually measuring that? Or if we're looking at dietary outcomes, is it actually a true representation of dietary intake within a particular population? Okay, so the reliability looks at the reliability of the test, and the validity looks at the actual valid way in which it's measuring that construct. And what it's intended to. So it refers to the credibility or the believability of the research. So often when you're critiquing things or putting on that critical analysis hat, we can start to really, nut these things out by sort of saying, well, if you're wanting to assess how often someone is physically active, and you're asking them to do it in this way, is that the best way to be doing that for that population group? Is a pedometer going to be a true, accurate measure? You can cheat pedometers by putting your pants on up and down every time you go to the toilet. So is that going to decrease the validity of that step-by-step measure for the day? And again, there's always theoretical ways to do that within academic research. So the first way is looking at the actual internal validity. So this is when we're really getting to the nuts and bolts of looking at the actual content and construct of that validity. is that measure what you want it to measure? And this is something for you to start thinking about, Aileen, maybe if you're needing to look at data or looking at collecting data, or if you're ever looking at wanting to assess or go forward and actually develop a survey in your future workplace and practice, well, this is when you really need to look at what it is that you're wanting to assess. So, you know, is the measure what it's doing what it's supposed to do? So if we're looking at stress within people, is the activity that you've developed actually going to look at that stress factor? So in this example, as part of a stress experiment, people are shown photos of war, and then after the study they asked how the picture made them feel. And, you know, if the picture made them feel pretty happy, feel like they wanted to go and, you know, do something that was in a positive sense, then maybe you think, oh, if I was trying to elicit stress within that population, is that the way that I want to do it? Okay, so often you can recheck in with what you're doing in terms of the response of the participants as well. So that's internal validity. We then also have what's deemed external validity or face validity. This is probably the weakest way. So when we're trying to actually measure internal validity, there's quite a process to go through. And we're not going to go through that today. We'll talk a little bit more about that in a minute. But it's quite often there's a lot of research applied just to actually determine the exact internal validity of something, where external validity is something that you could probably do in a much more obtainable way. And this is really when it just look at something face value. And we look at, so instead of actually nutting down if it does or does not measure, say, psychological distress in something, face validity is something where we can look at it and go, okay, we want to know the vegetable intake for someone, and we can see that the questions that I have chosen actively ask that. So we can say at within face validity or external validity that it does do that. In a critique point of view, that's probably a weaker way of doing this, because we know that people then might not actually truly represent their dietary intake, in terms of they might not actually put down all that they've eaten or put down more than they've eaten, but that's not what we're going to obtain from just face validity. So it is just a good check-in, and often it's a good one to use on your surveys when you're going back and or working with your supervisor to look at what you're asking in terms of outcomes, is just to give it a good external validity check. All right, so let's think about this a little bit more in practice. So if we think back to some of those data collection tools and methods that we were talking about to start off with, so let's pick one. I think this is probably going to be easy. I was hoping that we might have a bit more of you on board to discuss all the different ways that we could do this. So let's think about survey. Okay, we're going to pick out survey data, and we're going to pick out the fact that we're wanting to ascertain if we're looking at hand washing, okay, and we're looking at a Likert scale in terms of how often. So we could look at if people think hand washing is important or not, and we've got a Likert scale from 1 to 5, of 5 being yes important, 1 being no important. So that's going to be our tool, our data collection tool. So do you think from a construct point of view, do you think that that measure would effectively measure people's ideas about hand hygiene? Because basically we're asking about hand hygiene with that. I'm going to be quiet and then let you have a think about that as a group, and tell me what you think about what construct do you think it was. Do you think that is a construct that is going to measure hand hygiene? Oops, sorry, Jess, I think we couldn't hear you.
What was the survey question?
Do you think hand washing is important? So if we go back, let's talk it through. So if we go back to the construct validity, which is what we were just talking about. Do you think that asking someone if they think it's important is going to measure is actually going to measure effectively their hand hygiene?
Well, like, what do you want to know? Do you want to know how often they wash their hands, or do you want to know if they think it's important?
Exactly, and you've hit the nail on the head there, Jess, by even asking me that question. So with a simple 1 Likert scale of asking if they think it's important or not, you've answered that brilliantly, because then that's right. You can't tell. They might think it's important. But then if we're actually asking about hand hygiene and they actually don't wash their hands at all, is it really important? So yeah, absolutely. So you can see there that when you're developing a hand hygiene survey, you need to have several different ways of asking that question. Does that make sense? Can you see then how that just by you critiquing that, by asking that question, that was a great way of saying, well, what are you asking? What are we asking? And is that going to be a true depiction? Does that make sense? Does that sort of show you all how that you need to by just having one question in a survey is not necessarily going to actually answer the question or collect the data that you're wanting to answer. Does that make sense a bit more? And what is there a better way that you could also look at hand hygiene, in terms of, we could ask how often they wash their hands. We could ask if it's important. In a survey, what would be another way of adding sort of depth to that data that's being collected?
Observational quantitative data. So maybe if you're on a ward, for example, I think there's been some studies where they'll have like observational, how often does a nurse wash their hands? And they'll find half the time, for example, just hypothetically, they don't wash their hands before they go see a patient, or they always wash their hands after they see a patient. And then you also get habits about when they don't wash their hands compared to the context as well, not just do they wash their hands.
Yep, wonderful. Then that's exactly right. So on face value, you might think that you're getting information from that survey, okay, from the Likert scale and then the amount of times that they wash. But then without adding that observation or that qualitative, also interviewing might be your way as well, then it might not actually be a true and valid depiction of their hand hygiene practices. Wonderful.
Could you also ask how long they wash their hands? Like they might just put their hands under for a couple of seconds and go out or something like that. You can figure out if they're actually standing at the sink and washing their hands properly for the length.
Exactly. Yep. And, and that's also a good way of pairing in with the observation that Jessica was talking about as well. Are they using hot water? If it's potentially in a developing country, they might see it as important, but they don't have, hot soapy water to actually complete the correct hand hygiene practices. So then their the validity, so they might, if you think back to that 1 Likert scale that we started off with, and yes, they might see it as important, but then by the time you add how often they wash it, exactly how they wash it and observe it, then you can see that what they reported on that Likert scale might not actually be a valid representation of what they are doing in the first place. Does that make sense? So that was, that was what I wanted you to start looking at critically, is that, and thinking about when you're developing all these different survey tools and whatnot, that you often need to ask the question and use multiple sort of survey tools or research methodologies to actually provide a valid way and a reliable way of measuring that health outcome that you may be looking at. Any other questions?
Could you also like design a question that targets what products they are using to wash their hands?
Yep, exactly. So you could then add to your survey, list what you're using. You could make it open-ended, and that's often something too within that limits the validity limits that construct validity, is that often short answer or categorized tick box answers then force people to place an answer in that box. Where if you were to ask an open-ended question, you might get quite a varied response that actually is a more true depiction of, and also at times a categorized dichotomous questionnaire might then also provide an untrue depiction of what they're using. They might say, oh, well, I know that I probably should be using that. So I'll tick that option, where if you give an open-ended box and they don't actually identify what they use, or if they don't identify the correct product, then you can see that there is limited knowledge within that hand hygiene sphere. Does that help?
Yes.
Yeah. Excellent. So I suppose, the thing with reliability and validity, like I said, that it is, people spend entire research careers on actually pulling out the pure sense of is the construct measuring what we want to be measuring, particularly in those really important clinical spheres such as the psychological distress and anxiety and depression and whatnot. And it's a bit of an ongoing measure, and not one single study can often show this. So the take-home thoughts really for what I wanted you to go home with today is the fact that it's important to critically look at what you're developing. And a way of also ensuring that there is validity within a tool that you're developing is search in the literature for validated tools. And then using those tools within your own surveys is often a way of ensuring that you're assessing what you want to be looking at. So it's something just to think about when you're developing your tools or developing research in future spaces that you might be going into, is looking online for those validated tools is often a way of self-checking and self-assuring that the data that you're collecting is what you want to be looking at. Does that make sense? Excellent. All right. Well, if not, has anyone got any other questions before I move on? No?
No.
All right, so like I said, I was hoping that we'd have an Indigenous health talker today. Unfortunately, she was too busy and I couldn't get her input today. But I wanted to still touch on this, particularly as I know that some of you might be working within this space in public health practice in your future. But before we talk about this, I want you to think about how you identify yourself. And it's not, and I don't want you to think about it in terms of Indigenous or non-Indigenous. I just want you to simply think about how you identify yourself. So I'll start just to give you an idea. So I identify as obviously female, and I identify as a mother, and identify as probably a white Caucasian female, which is something that I know I sort of fit into. So I want you to think about, so if I was to check in on a tick list, that's probably how I would check myself. How do you identify yourself, Jess?
I identify as Eurasian, but I don't speak any Asian languages. But I do kind of follow some of the traditions and stuff. So like this afternoon, I've got to go take my Nana moon cake because the moon festival is coming up soon. So little things like that where I don't actually speak their language, and I wouldn't get by if I lived in China suddenly, but there is a history, there is a background. But I identify more as an Australian, I think.
Yeah. Interesting. Alex, how do you identify?
For me, I'm Alex. I was born in Hong Kong.
Yeah.
Yeah.
So do you identify as Hong Kong Chinese?
Yeah.
Yep, yep. And do you also identify as Australian?
Yes, of course.
Yeah, yeah. No, it's interesting. But it's interesting that
because
yeah, go on.
I'm here.
Yeah.
Yeah.
Aylin, how do you identify?
Female student.
Yeah.
Born in the Middle East, in Iraq specifically, but I have lived half of my life in Australia. So I am also Australian. Yeah, not much.
Yeah, no, that's plenty. That's wonderful. Alana, how do you identify?
Yeah, identify. So born in Australia, but I resonate mostly with my Italian heritage. I can speak a little bit of the language, but we do keep up with a lot of the traditions that my grandparents have passed down and my family keep in touch with.
Yeah, interesting. So if you were to be given a checklist on a hospital registration form, let's start from, we'll go bottom up this time. Alana, would you identify just as Australian or would you identify as Australian Italian?
Well, it would depend if it's like where I was born in Australia, but as like nationality and background, I feel I resonate more with Australian Italian.
Okay, yep. Aylin, would you, if you were asked on a hospital form to tick your cultural background, would you just tick Australian or would you tick your did you say Middle East, depending on how that was depicted, or would you just tick Australian?
I'll probably would say Iraqi and then Australian because like my culture is like, you know, like I live with my family and everything, so I've got all of that culture and everything.
Yep.
And like I said, I've also lived almost like half of my life in Australia, so I think I'll go like Iraqi and then Australian maybe.
Yep. No, interesting. Alex, how would you tick the box? Would you tick the box just as Australian or as Chinese Australian?
Still Australian citizen.
Yep. And Jess, how would you tick the box?
I think it depends on the question. If it says what ethnicity are you, or then I would probably put Asian or Chinese and then Australian. If it asks me what culture I am, I will put Australian.
Yeah, interesting. No, it's interesting just to have a bit of a talk about how we would identify on forms and lists, because often in the healthcare setting, Aboriginal people are asked to identify or not identify, and sometimes they don't identify, and sometimes they do identify, and often that can place them in different, what they perceive as different ways that they're cared for within the healthcare system. So at times they don't identify, and at times they do identify. So it's just interesting to think about, you know, in your own cultural background, how you also identify within these healthcare settings and then the care that you receive at times. How would you describe Indigenous, or what terms do you think are commonly used to describe Indigenous Australians in the healthcare setting? Does anyone come across this at all?
Aboriginal?
Yeah, just the common Aboriginal Strait, Torres Islander.
Yep. Alana, have you come across any different terms?
Not like, I mean, obviously we use like ATSI as an acronym for them, Indigenous Australians. But I mean, I've heard some people say, I guess, derogative terms about them, like, you know, shortening Aboriginal, like to say, like I feel bad saying it, like saying Abros.
Yep.
But like I have heard that before, which is kind of like a bit upsetting.
Yeah.
You know? Like even though I'm not identifying as Indigenous Australian, I just still don't think that it's a right term to use, like when you're speaking about them.
Yeah, and I think, and that's exactly what I was wondering about within this discussion. And that's exactly right, that, you know, there are often derogatory terms still used within the healthcare settings, and it's not necessarily from healthcare workers, but it's just different cultural or different social circumstances use different derogatory names. And it's something that, you know, as public health professionals, if you're working in the Indigenous sphere, you will come up across. And it's how we then navigate those to better the health outcomes and champion or stamp them out within our society as well. And the other thing too that I wanted to talk about here is that if you often maybe not in Western Sydney as such, but within, I know within the Northern Territory, and quite often within remote Indigenous health within the Northern Territory or Western New South Wales, often people identify as half caste or full caste Aboriginals. And this is often something that socially can be considered difficult to navigate within the healthcare system, because when they're identifying into either of those groups, they are often thinking that they're going to be stigmatised in one way or another. And if they don't identify, if they're half caste and they don't identify as Aboriginal on a healthcare worker sheet, that is often because they feel that they might be stigmatised within that healthcare setting. So it's something that I just wanted to sort of start thinking about as you might be entering in these different workplaces, in different settings, that you might need to be thinking about as well. Cultural competency within public health practice. And I think, like I said, it's something that I just wanted to put on your radar to think about. And when we're talking about cultural competency, we're really talking about that inequality, or it's important to have cultural understanding within healthcare systems to really break down those barriers of inequality within healthcare access for Indigenous Australians, and also improve their access through their acceptance, or through their understanding that they will be culturally safe within these healthcare practice, within these healthcare settings, and building that trust as healthcare workers, be it frontline, so if you have got direct patient contact, but even also from a public health point of view in terms of looking at interventions that we're developing or increasing their access to healthcare systems. It's really important that we have an understanding of what cultural competencies within healthcare, within Indigenous health are. I found this set of data. Yeah, Alex, do you have a question? Nope. Yep.
Nope.
So I found this data table, and this is what I just wanted to sort of bring back to sort of what we started off this group discussion about, in terms of the fact that there is still quite severe discrimination within the healthcare sector. For some reason, when I cut and change that, it's come across with a little plus, but they're ones for some reason. Sorry, I just realised that. But we can see that within a 12-month period, there was still 21 Indigenous Australians that visited the dentist, 31 that visited the doctor, that experienced what they considered discrimination or not culturally appropriate language. And also then obviously if they're experiencing these high rates of what they perceive as discrimination, they want to access healthcare and their ability to access healthcare is obviously going to be diminished. Okay, so it's important that that's what we start to look at in terms of building within that cultural appropriateness and that cultural understanding within the healthcare services to then be able to address these issues. So to do that, there has been a national Aboriginal and Torres Strait Islander health plan that was drawn up in 2013, and it really does draw that attention to that centrality of cultural within Indigenous health, looking at the fact that cultural identity is different for Indigenous Australians, and that we need to have an understanding of that to then empower their ability and they feel safe within access to healthcare systems. And to do that, there's been a cultural respect framework developed that really is to develop a capacity building within the health systems and have an embedded cultural respect within our healthcare system to enable Aboriginal people to feel safe within their access. And it's got a 7-point plan. The framework's very large, and like I said, I'm not going to go into depth today into this. It's just something that I want you to start thinking about, that when you're developing interventions or when you're developing communication channels within Indigenous communities, you need to think about these aspects. So the fact that and it can't just be isolated to an individual. So the framework really looks at the fact that it needs to be a whole organisation approach. It needs to look at communication and appropriateness of communication. What are the communication channels? So if you're working within Indigenous communities, you need to start thinking about communication within that community, being looking at talking to elders and having those communication channels opened up in a way that is respectful within their cultural practices. You then also need to have workforce training and development within the health industry and within that health sector that you're working, and also look at having burdens be minimised in terms of cultural burdens. And then you also need to look at the actual Indigenous participation engagement, in getting out and into the communities and engaging with them and letting them own those cultural communications. And that also brings in that stakeholder partnership and collaboration, and then looking at that data collection and planning. So, I mean, they're very broad because that's what the cultural frameworks are, but it's something that we really need to think about in terms of when we're dealing in developing interventions within the Indigenous health focus. So I thought I'd just finish up with a bit of a group discussion about how you feel in terms of having cultural competency to work within Indigenous health. Do you feel that you have the competencies to work within Indigenous health?
I think like any decent person should have that. It's like, you know, like they don't need special, I mean, they might have to sometimes have training and things like that, but I think just like the common, you know, like values, I guess, then can some make people have these competencies. So as well as like training and knowledge is very important, but I think just like not being judgmental and just like being fair and providing the same service that you would to anyone. I think, yeah, that should be like a lot. So
yeah, no, interesting. And do you feel that you would, you know, be able to approach an Indigenous elder effectively within an Aboriginal community?
Yeah, 100%.
Yeah, that's wonderful. That's,
yeah, I'm very confident too, because if you bring on like the positivity and should be a nice person, you know, very simple. I think, yeah, that's what they're looking for, because they would have this, they would think that all people are judging them and all of that. So if you just like very nice, yeah, just don't judge and all of that. I think that's very important.
yeah, wonderful. Does anyone else, Alana, do you feel that you would have the competencies to work within the Indigenous health space, cultural competencies?
I think theoretically I would know how to do it, but I personally, I would think that the Aboriginal community would be more comfortable discussing these kind of issues with someone else who was of Aboriginal descent or had some Aboriginality in them. So maybe I would kind of see if there was a way that I could work with them that we would both feel comfortable to do so. But I think in the practice element, I would still be hesitant. But I would know the right ways to go about with communication and the cultural competency aspect of it.
Yeah. Excellent. No, and yeah, you're absolutely right. We need to always pair with a member of the community, but opening up those communication channels, and if you have the confidence to do that, I think that already is a step ahead. And like Aileen said, that she had the confidence to reach out and do that, because often I think people don't have that confidence, and then that process isn't undertaken. So I think that's really fantastic that you do feel that you have those competencies under your belt as you head out into the public health sphere. That's wonderful.
I would also like to mention something that someone can like pretend they are confident, but if they really don't feel too confident with that, I think the person they're trying to be in contact with, they would feel that. Even though people trying to pretend so, but I think if the person does not really work on themselves and get all of this confidence, it's not going to like work as well.
Yeah, no, I think you're right. You need to be sure within yourself that you feel able to work within that cultural space as well. Alex, how do you feel? You're going to be working with Indigenous people with your project. How do you feel about talking and working within the Indigenous health community, within the Indigenous community around health?
Okay, for example, is to more understand their living environment and respect their culture. That is how we do.
Yeah. And do you think, like Alana said, that, if you work with an Aboriginal person within the Aboriginal community, that will help show that respect?
Yes.
Yeah. And so are you going out and interviewing Aboriginal people, or how are you what's your project involve?
Languages.
Okay. Yeah.
And languages translator.
Yep.
And have to fully understand.
Okay, yep, no, that's fine. And Jessica, do you have any comments on how would you feel going into working within the Indigenous community? Do you feel that you've got the skills and knowledge to approach that?
Yeah, pretty comfortable. One of my friends is Indigenous and I hang out with her mum occasionally. It's totally fine.
Yeah, yep. And do you learn anything from that experience and how they view health within their culture?
I think a big part for them is just family.
Yeah.
And family is everyone in their community.
Yeah. And is that different from your
experience? Definitely.
Yeah,
Yes.
Interesting. Yeah.
So I think being aware that whilst I might not agree with their choices, that we do have to respect them and just like empower them and maybe provide information, but we do really have to respect what they say.
Yeah, interesting. That's really interesting. Do you think that there's any way that you would you could improve your cultural competencies in terms of, do you feel is there anything that would make you more confident to work in that space?
I guess maybe more experience, perhaps.
Yeah.
But I also like, in terms of tradition and community, I think there's only a certain demographic that I can really communicate and reach within Indigenous culture. And I think for sustainable long-term change to reach a whole demographic, then that's really something that the whole demographic of Indigenous people have to be able to have input in and collaborate on.
Yeah, absolutely. I think that's a very important point to raise. And for sustainable change, absolutely. Unless they all are able to have a voice and have a say, and own the issue, then change won't happen. Is there anything else that would give you more confidence, Aylin?
Maybe just lots of knowledge and experience, like Jessica mentioned. I think once you are exposed to the environment and have more communication with the Indigenous people, that's where like the experience and the knowledge comes from.
Yep.
And so I think that would improve a lot.
Yeah, wonderful. Alex, anything else for you?
Just improve your language skills.
Yeah.
And you understand.
Yeah, and understanding that their cultural and their language skills are different to what yours would be. Is that what you're? Yeah.
I think always to have an open mind as well. And it's just give me an idea. An open mind is very, very important.
Yep.
So that help as well.
Yeah, interesting. Yeah, no, absolutely. Um, I heard the story the other day that sort of just made me think about this space a bit more, and the fact that they're really struggling with children attending school, and they're learning in rural and remote communities outside Alice Springs, and an initiative that's been working. And part of the issue is that and this comes back to your point, Alex, about languages, is that they grow up, their first language is not English. It's their clan language, and they hit kindergarten and they're expected to go to school, and all the books that they're learning to read are in English. So it would just be like any other person sort of not having spoken very much English for the first 5 years of their life, sat at a desk and expected to read a English book. So what they're trying to do is actually have families write stories that are culturally appropriate to them in their local language, and then build the English in slowly over time. So it's little elements about understanding the fact that Peppa Pig is not going to be very relevant to a Aboriginal child in remote Australia, but rather another pig story that's relevant to the fact that they're fattening the pig up to eat the pig is actually more relevant to what's culturally appropriate for them. So it's just and I thought that was a really interesting aspect in terms of understanding the different cultural practices and then building up that education basis that then can help. So anyway, that's just a thought that I was going to leave you with in that space. And that's all from me today. Does anyone else have any questions before I head off?
So can I ask you just like one-on-one after we finish?
Yeah, certainly. That's not a problem. I'll stay on. Jess, do you have any questions?
Do I have any questions?
Yeah.
Yeah, just one-on-one about the assignment afterwards, I think.
Yep. What I'll do is I'm trying to think how Aylin, I'll talk to Jessica first, and then I'll send you a new Skype link, and then I'll Zoom link, and then I'll Zoom you one-on-one. Does that suit?
Yep, I mean, I just have 2 simple questions. Yeah, that's all right. I just don't be too much effort for you.
No, that's all right. I'm happy. I mean, yeah. Alex, do you have any other questions? Are you okay?
No, no thanks.
Okay. All right. Well, I'll say goodbye to Alex.
Oh.
Hi, Alex. Or I'm heading to you, and then we'll wait for the invite.
Okay. All right. We'll do that. Okay. See you, Alan. Bye.
Catherine, excuse me.
Yep.
I just want to know is today workshop on next week, do we have another workshop?
No. So this is the last one until your presentation week.
Oh, okay.
Yeah.
Thanks, Catherine. Thank you.
That's all right. See you, Alex. Bye. Jess, now with the assessment, I'll just stop the